RTLS. My name is Evelyn Castro, and I'll be presenting with Rup Kamal Gurwal and Infa Borja. Our presentation is about the implementation of real-time locating systems inside of hospitals. The problems that we are facing today inside of the hospitals is the miscommunication or delayed communication between departments during the transfer of patients from one department to another. Another thing as well is files being switched, lost, or misplaced. When this happens, you're getting patients that are receiving the wrong procedures, patients that are getting the wrong medication or the wrong dose of medication, and this can actually lead to horrible symptoms, and that could actually lead to death. So in other words, patient safety is at risk with human error, and RTLS can actually fix that as well. Another thing as well that we're finding is that we are misplacing equipment or beds that are not being used, and that's money that we're losing due to not having patients or anyone taking care of that. How the RTLS can fix this is that professionals now can actually manually insert or input the data of the patient, and they can track the patients throughout the hospital. They can track equipment throughout the hospital. And we can also track the staff members as well. So nurses, doctors, whenever we need them, we can track them. We'll know where they're at. And everything, patient flow will be a lot smoother. Real-time locating system as an information system. The real-time locating system, it provides the hospital with information regarding the location and status of the patients and the equipment as well as the staff. The way that it works is you are going to have one little locating plug-in that you plug. It's a sensor that you plug into the wall. That sensor locates the tags that are inside of the room, and the nurses and doctors can actually go into their workstation, put up an NID number, and they can actually bring up exactly where that equipment is at, or the patient, or where the patient is located. As well as the doctors and nurses, as soon as they walk into a room, they can scan the tag of the patient. They'll tag their own badge as well, so that we always know which nurse, which doctor was with which patient at which time. And they'll also know exactly which doses, etc. So it makes everything a lot smoother for the hospital. The workload of the nurses goes down, and it just makes everything run smoother. And it's an easier way to verify exactly what procedures the patients need to get. And here's kind of a picture where you can kind of see exactly how it would look in the workstation. As you can see, it shows exactly a map of the hospital, and the tag and the sensor will actually show exactly where inside of that room that equipment is, or the patients. When it comes to costs and benefits, there was actually a hospital that ran a 3-month test with the system. They saw that there was a decrease in bed turnaround time by 53%. They had a decrease of admission turnaround time by 85%. They had a 11.5% increase of inpatient admissions, and a 10.6% decrease in the average length of stay for each patient. The estimated savings and costs was $1.7 million during the first year alone. When it comes to the cost of the system and the database and the infrastructure that we're trying to implement, we see that the total cost will come up to $645,000. That's not including the installation costs or the training, which at training we have at about $21,000 for the first month, $11,000 for the second month. The installation cost, it should only be $50,000 for the entire hospital. The Wi-Fi, as you can see throughout the whole, during the time of implementation, Wi-Fi will remain the same for $25,000 throughout. And basically the total cost of everything would be $886,000. It's actually including, however, $120,000 of lost equipment that we still have to see. And the reason why I added this onto here is because you'll see throughout the 5 months that the lost equipment is actually reducing, it's actually decreasing, and that's just due to the after implementation of the RTLS. However, the actual total cost of just implementation of the system is $716,000. And as well with this chart, The second month after implementation, we're going to see that our revenue is actually going down just a little bit. We're not going to see profits yet, and that's normal when you're starting a new system out due to the staff getting to know and become familiar with the system. So, however, our payback period for the entire system alone is 5 months. And that concludes my part of the presentation, and I will allow Ninfa to continue with the database.